Most people don't realize that forcing hip internal rotation to restore hip internal rotation isn't always the best course of action. If you're stretching your hips and they still feel tight, pinchy, and blocked, this is the reason why. Hip internal rotation is when the hip glides in and backwards into the socket. The hip only has so much space within the socket. You'll see people have a lot of external rotation of their hip, but have no access to internal rotation of their hip. When you try to aggressively access internal rotation, you don't want to force the hip into a space that we don't have. And this is where the pinch lies. What we can do is work from an externally rotated position into an internally rotated position to regain more space in that area. And this is how you do the exercise. You're gonna lay on your back with your feet against the wall. Hips and knees are bent at 90 degrees, keeping your lower back flat against the floor. Placing a yoga ball in between your knees. Gently pull your feet together on the wall. This starts your hips in an externally rotated position, which is something that you do have as you lack internal rotation. Gently squeeze the ball between your legs and hold it for about 3 seconds. You want to push with about 3 out of 10 pressure here. You should feel the inner thighs, the adductors, turn on. Common mistakes that we see is the legs squeezing way too hard against the ball, feet drifting apart or coming off the wall, or the lower back arching. Try to do about 10 repetitions of 3 sets. Use this drill as a beginner so that we can introduce more internal rotation drills later on.